Hi, my name is Christina Blankenship. I'm going to be doing my important speech on Bell's palsy. Imagine waking up in the morning and looking in the mirror, realizing that half your face is paralyzed. Well, that's exactly what happened to me about 4 years ago. I was rushed to the hospital because I thought I was having a stroke. But I come to find out that I was diagnosed with Lyme disease, and Bell's palsy is a symptom of Lyme disease, second stage Lyme disease. So today I'm going to be telling you exactly what Bell's palsy is. I'm going to tell you how to detect it. I'm going to tell you what it is and some of the treatments. So what is Bell's palsy? It is a form of temporary facial paralysis resulting from damage or trauma to one of the facial nerves. So basically it's just half your face is completely paralyzed. Typically affects half of the face, but in rare cases it can affect both. The function of the nerve is disrupted, causing an eruption in the messages the brain sends to the facial muscle. So some of the ways you can detect it, some of the symptoms are the twitching and weakness of your face, drooping of the eyelid and the corner of the mouth, and an impairment of the taste. Also, some other signs could be discomfort around the jaw and behind the ear, ringing in the ears, hypersensitivity to sound, and dizziness. Some of the symptoms that I personally had were I had severe ear pain, and then I had drooping of my eye and of the corner of my mouth. But within 48 hours, I had no function of my eye at all. I wasn't able to shut it. And it stayed that way for about 30 days. So some of there is no known cause for Bell's palsy, but scientists believe that it's caused by a viral infection, which causes the facial nerve to swell and becomes inflamed in reaction to the infection, causing pressure within the fallopian canal, which leads to ischemia. Bell's palsy has also been associated with headaches, chronic middle ear infection, high blood pressure, diabetes, tumors, Lyme disease, and trauma such as skull fracture or facial injury. So your question is, can it happen to me? Well, the answer is yes. It affects about 40,000 Americans a year in the ages between 15 and 60, and it affects women and men the same. So the diagnosis for Bell's palsy is basically it's going to be a physician or it's going to be the doctor. They're just going to evaluate your symptoms, and then they're going to, based on that, they're going to diagnose it. There's no specific lab test that can prove and confirm the disorder. So some of the treatments for Bell's palsy, they're based upon the severity of it. Some people, it can last for 2 to 3 weeks, and some people it can last 6 months, or even some people, they won't completely recover from it. But they use medication and they use therapy to treat Bell's palsy. The medication they use is steroids. Some of the therapies involve massage, electrical stimulation, and then also vitamin therapy. With my personal experience, I did do medication first, and then I did therapy. I did massage therapy and also the electrical stimulation. But therapy didn't work for me. I did it for about 2 months, and then when I quit doing the therapy, I was able to recover, but I still didn't recover 100%. So the research that they've been doing on Bell's palsy includes they've been focusing on the circumstances that cause the disorder and also developing methods to repair the damaged nerves. Thank you for watching my speech today.